Hi, I'm Dr. Jeremy Chow, cardiologist and electrophysiologist with Asian Heart and Vascular Center. I was COVID positive.
I'm Xiao Ying, senior nurse from Asian Heart and Vascular Center. I was COVID positive.
I'm Grace from the AHVC admin team. I was COVID positive.
Hi, I'm Pei Ying. I'm the senior nurse of Asian Heart and Vascular Center. I was COVID positive.
Hi, I'm Lillian. I'm a nurse at Asian Heart and Vascular Center. I was COVID positive.
Hi, I'm Pipin. I'm a consultant cardiologist and electrophysiologist at Asian Heart and Vascular Center. I didn't get COVID.
During COVID, I think my symptoms were mainly triggered by sore throat and a little bit of body aches and mainly just a bit of cough as well. I think I took 3 to 4 days to recover, and ART negative at day 8.
My sign and symptoms was body ache, slight fever, but very bad sinus and cough. I took about 5 days to recover.
My symptoms, I think I was experiencing obesity because I was just eating and sleeping during COVID. No, but I think I had slight cough and sore throat, quite mild symptoms. Yeah.
So Dr. Chow, are Grace and my symptoms considered serious?
Well, I think all three of us fortunately were very mild because most of our symptoms are that of upper respiratory tract infection, which is like a common flu. So most of us actually just had a common flu, what we call the guardian variety of the COVID infection, thankfully. So it's not considered to be serious.
Okay, so for myself, it started off first with a sore throat. So at that time, I had a lot of spicy food, so I imagined it to be something else. However, to my horror, on day 5, I actually tested positive for COVID. So day 1 was still okay. When I went to the GP, I was actually very confident. I was telling the GP, oh no, actually I feel quite okay. She was like, you wait. So day 2 is when the symptoms really hit me, and they hit me really hard. I felt like I was hit by a truck basically. So the sore throat became much worse. The cough started, and the sore throat was so bad that it was agony each time I tried to swallow. Simple things like running after the bus, I was winded, and it was less than 5 meters. So I panicked. I went to see the same GP again, and I asked her, I said, doctor, what's wrong? Why am I still like that? Why am I still coughing so badly? Why is my sore throat still so terrible? And she was like, oh, it's because you had asthma as a child. And I was like, oh, okay. That was not something that occurred to me the past 7 days. So basically, I stayed at home for another 3 days, and after that, I was feeling much better already. Although it did take me about 1 month to get back to my original form.
Okay, my sign and symptoms was I was having backache and also sore throat. And then after that, I developed fever that went up to 39.8. Then it took me about 10 days to recover to be fully negative. But then I wasn't fully recovered. I'm still having a very bad cough, 1 out of 10.
So what would you consider serious?
Okay, the serious COVID symptoms will be those patients who have COVID lung infection. So when you have COVID lung infection, otherwise known as COVID pneumonia, then you will have lung symptoms which will also cause you to have lower oxygen content. So you get breathless, persistent cough, and your oxygen saturation will be very low. And in a more severe form, then you can get complications from COVID, which will include blood clots in the heart, and unfortunately some patients may also trigger acute cardiac event.
Okay.
So since the onset of COVID till now, in our practice, we actually are seeing more patients coming to see us after they recover from the initial flu-like symptoms. The first set of patients who came to see us during 2021 who had Delta strain, and before, they actually have a lot of symptoms including breathlessness, palpitations, fast heartbeat, as well as non-specific chest discomfort. In this 2022, the patients who mostly recovered from Omicron, the majority of them come to see us because of very fast heartbeat, as well as some non-specific discomfort in the chest, which sounded a little bit more like a gastric acid reflux kind of symptoms.
Dr. Jeremy, so what kind of tests were actually prescribed for this patient if they can't see you for the persistent symptoms?
Okay, so that's a very good question. The patients who come to see us for persistent symptoms, we need to exclude any complications related to post-COVID infection. So commonly, we have to screen and rule out for any myocarditis, pericarditis. So the simplest bedside test that we do in our clinic will be a simple ECG followed by a 2D echo, which is an ultrasound scan of the heart. And we also would advise to run some blood tests if it has not done previously to look for any evidence of blood clots. These are the common tests that we do in our clinic. If any of the tests are not normal, then we will suggest to the patients to do further evaluation, which may involve further tests including cardiac MRI, or if we think that the symptom is more related to a lung condition, then we will organize some lung function tests as well as CT scan of the lung.
Okay, thanks, Jeremy. So we are all seeing more patients in clinic every week who have developed COVID recently, and I think the common complaint that most of the patients share is that they don't feel back to normal after the infection. And generally, you can think of the symptoms that they have may relate to their heart, so they may complain of chest discomfort, palpitations. Some may sound like lung problems, so they feel a bit breathless, they have a persistent cough, and they feel that doing the routines that they are used to takes more effort. And then of course there's also some neurological symptoms, so things like sort of people say they feel that they cannot concentrate, something called brain fog, or they feel that they feel difficulty sleeping, feels a bit anxious. In fact, some patients have noted that their temper and mood has even changed after the infection.
Hi, Dr. Pipin, I actually have a question. So basically, just now I mentioned that I had asthma as a child, and because of that, right, it actually made my COVID recovery journey a bit longer. So does this mean that I will suffer more complications from respiratory infections?
So we think that patients who have pre-existing heart and lung conditions are actually more likely to get severe forms of COVID. So in fact, if everyone remembers, during the early phase of the pandemic, we were prioritizing vaccines for patients with pre-existing heart and lung disease because of that. And I think that's generally true for COVID and also other kinds of respiratory illnesses.
Hi Dr. Pipin, I have a question for you. Because for instance, lately I realized that there's a drop in my stamina. So when I bring my kids over the weekend to the park connector for some cycling activities, I felt that I couldn't catch up with them, and I felt very tired easily. So is this common?
Yeah, so it's quite common for patients to complain that it takes them at least a week, 2 weeks to make a recovery from COVID. But if the symptoms persist beyond 2 weeks, then it's generally recommended that you see a doctor, and the doctor will probably perform some tests, some of which is quite simple, maybe a chest x-ray, maybe an ECG, just to make sure that there's no complications from the COVID infection that may be causing you to have those symptoms. Okay, lastly, I recommend that we all keep fit and eat a balanced diet, and always encourage you to do exercise. Start with some light ones and then progressively build up from there. When you're in a crowded place indoors, please wear a mask to protect yourself and your family. And with that, I wish you all good health and take care of yourself. Thank you, goodbye.
Thank you, everyone.
Please like and share.
Please go to www.ahvc.com.sg.
Bye.